Okay, so we've got through our multi-diagnosis patient and everything looks good. We've gotten through all this. Now it's time for the actual time that we're going to dedicate to patients, specifically for patient education. So patient education is baked into the whole visit. So we're educating them the whole time why we're doing what we're doing, why their strength feels better, why their pain went away, why their range of motion is bigger, all that kind of stuff. And then when we get down to the end, then we're really going through, so we drive home what we did and why it's different than anything they're going to get anywhere else, why they need to keep coming back and send their friends. Okay, so we've already written home exercise program on the back, whatever we gave them, gone through that with them so they understand what that is. They're going to flip it over and we're going to say, and now, important part, if I'm working with I just got done treating a 12-year-old gymnast and mom is sitting in the chair, who am I doing this for? Mom, not the daughter. Daughter doesn't get a pick where she goes to physical therapy or where she goes, okay? Mom does. So mom needs to understand why she needs to come here, okay? So I'm standing there with the daughter and I'm going through this with her, but I also give mom the exact same thing and say, follow along, okay? So 180 system is what we do here, which is the opposite of regular PT, chiropractic, and massage. Those guys are trying to make you feel better. We're fixing the root cause of the problem. So everything that we did today is patented, which means we are the only ones that can do it and people that are trained by us. And the whole point is to get the muscles to fire. So when I was turning on those muscles and it felt stronger, range of motion got bigger, that's the whole point of what we're doing. That's what we have patented. We're the only ones that can do that. So when your muscles actually fire the way they're supposed to, when they're supposed to fire, your biomechanics get better. So your low back pain goes away, your plantar fasciitis goes away because you're unloading the tissue that's angry. Your strength will improve, your performance will improve, your pain and injury will go away. So what we're shooting for is motion plus strength plus stability, which is what we call mostrability, okay? So things we want to avoid. So we gave you all the stuff we want you to do back here. Here's what we don't want you to do. So no stretching. So anytime you feel tight, no stretching, no leaning up against a wall, don't put your leg back, don't stretch your plantar fascia, don't pull on your head. Anytime you feel like you need to stretch, you do the stuff on the back. No inserts in your shoes, stay barefoot at home as much as you possibly can. No massage. If something feels tight, don't stretch it, do your exercises on the back. Don't rest too much. So if you've got somebody who's like desk work, you're gonna say, the reason why I want you to do this stuff 3 or 4 times a day, whatever you wrote on the back, is to get you out of the position that you've been stuck in, okay? So that's why that is on the back. Don't rest too much. No foam rolling, no lacrosse ball rolling, no vibrating guns, no popping your joints going to chiropractors, okay? That stuff might feel good temporarily, but it's what's unplugging everything that we just plugged in over here. And they'll be like, oh yeah. Now remember, you already went through this stuff with them on the table. You've already told them you're not gonna stretch, we're taking the inserts out of your shoes, you don't need to go to the chiropractor, you need to get up and be more active at work. So you've already done all of the patient education before you get to this. So this is not a surprise. So if you don't do patient education the way we talked about it here, and you wait till the end and say, oh, I don't want you to stretch anymore, they're gonna be like, whoa, wait a second. Now you're dedicating time to patient education, which you should not be doing, okay? This is just a review to kind of like drive home, they see it with their own eyes, don't do this stuff, okay? Then I'm writing down, you're gonna do your home exercise program 3 to 4 times a day, 5 to 6 times a day, whatever you want them to do. Then I'm gonna circle this and say, you're gonna get an email from us that's gonna give you videos of all this stuff on the back. So if you've got your Medicare patient that doesn't understand what you did, tell them, check your email, the video, all you gotta do is click on the video, it will walk you through the stuff that I gave you today, okay? Those videos that you're gonna get on your email are going to link to our YouTube page. So if you have more questions, or if you get home and your husband has questions, or your coach has questions about why you're not stretching, why you're not gonna go to the chiropractor, those videos will tell you what happens when you do the things that you're not supposed to do, okay? So most of our patients come from our patients. So if you know of anybody on your team or at home or at work that's having problems, tell them to come see us. They can ask for a free consultation and we'll demonstrate what we did with you with them, so you don't have to try to explain it and they can understand why we're doing something that's completely different than they've already tried. Okay, so there's the only time that you're dedicating time specifically for patient education. The rest of your patient education happens all the way through all of this stuff while you're doing all of that stuff.